Dear viewers, welcome to our learning community. We share medical education and MCQ practice to help you succeed in international exams. Each video is designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. Anatomy literally means cutting the body in order to examine its parts and their relationships with one another. The word comes from Latin and ancient Greek, anatomia or anatome. The prefix ana means up, and temnane or tome means to cut. So, anatomy translates to cutting up or cutting through. The term human anatomy refers to the study of the various structures that make up the human organism. In simple terms, it deals with the structure of the human body. It's important to note that dissection is just a technique used to study anatomy, but anatomy itself is a much broader field of study. Anatomy can be studied in several different ways. First, cadaveric anatomy, which is the study of the human body on dead bodies, either at the gross level or under the microscope. Next, regional anatomy, where the body is studied in parts, for example, the head, neck, limbs, thorax, or abdomen. Then, systemic anatomy, where the body is studied according to its systems. This includes the skeletal system or osteology, the muscular system or myology, the study of joints or arthrology, blood vessels in angiology, the nervous system in neurology, and the study of internal organs in splanchnology, which covers the respiratory, digestive, urogenital, and endocrine systems. Finally, we have the locomotor system, which looks at bones, joints, and muscles together as one functional unit. Branches of anatomy. Anatomy has several important branches, each focusing on a specific part of the body. Cytology is the study of cells, while histology deals with tissues under the microscope. Osteology focuses on bone. And ultrasound to study the body. Comparative anatomy, where human structures are compared with those of other animals. And finally, applied or clinical anatomy, which involves the practical use of anatomical knowledge in medicine. Phalanges. For the lower body, it includes the hip bones, also called the pelvic girdle, and the legs, femur, tibia, fibula, tarsals, metatarsals, contains the brain, while the spinal cavity houses the spinal cord. The thoracic cavity protects the heart and lungs. The abdominal cavity contains the digestive organs, and the pelvic cavity holds the consistent communication when describing the locations and relationships of body parts. In anatomy, superior or cranial refers to a position higher on the body, toward the head. For example, the head is superior to the neck. Inferior or caudal refers to a position lower on the body, away from the head. For example, the feet are inferior to the knees. These directional terms help describe the relative locations of structures in the human body clearly and accurately. In anatomy, medial describes a position closer to the midline of the body. For example, the heart is medial to the lungs. Lateral refers to a position farther from the midline. For instance, the ears are lateral to the nose. These terms help accurately describe the location of body structures relative to each other. In anatomy, anterior or ventral refers to a position toward the front of the body. For example, the sternum is anterior to the heart. Posterior or dorsal refers to a position toward the back of the body. For instance, the spine is posterior to the stomach. These directional terms are essential for describing the relative positions of body structures accurately. In anatomy, proximal refers to a position closer to the point of attachment of a limb to the trunk. For example, the wrist is proximal to the fingers. Distal refers to a position farther from the point of attachment of a limb to the trunk. For instance, the fingers are distal to the wrist. These terms are commonly used to describe the relative positions of structures in the arms and legs. In anatomy, Superficial refers to a position toward or on the surface of the body. For example, the skin is superficial to the muscles. Deep refers to a position farther away from the surface of the body. For instance, the bones are deep to the muscles. These terms help describe how structures are layered relative to the surface of the body. In anatomy, the supine position refers to when the body lies flat on the back, with the face, chest, and palms facing upward. The prone position is when the body lies flat on the stomach, with the face, chest, and palms facing downward. These positions are commonly used as reference points in medical examinations and procedures. Here is a quick summary of common anatomical directional terms. Superior means toward the head or upper part of the body, while inferior means away from the head or toward the lower part. Anterior is toward the front of the body, and posterior is toward the back. Medial refers to being closer to the midline of the body, whereas lateral means farther from the midline. Proximal is closer to the point of attachment or origin, while distal is farther from it. Superficial indicates a position toward the surface of the body, and deep means away from the surface. Supination occurs when the palm or sole faces upward or forward, and pronation is when the palm or sole faces downward or backward. These terms are essential for accurately describing the positions and relationships of structures in the human body. That brings us to the end of today's lecture on the Introduction to Anatomy. Thank you for watching. If you found this lecture helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future lessons. Keep learning, stay curious, and see you in the next session.